You are watching the DocTalk show.
Welcome back. Today we're discussing cholera, which is a very severe acute diarrheal disease, and the country is currently battling an outbreak in several districts within Uganda. Did you know that the human body, your body and mine, is made up 60% of water? And in the event that you contract cholera or this acute diarrheal disease, you lose huge volumes of water, all right? So our experts this evening, Dr. Fiona and Dr. Ann, will be telling us about the features of cholera, what can happen, and how best we can help ourselves. I'll start with Dr. Ann. Could you tell us more about what cholera does to the body?
Right.
On top of being a diarrheal disease.
Right. So like Dr. Fiona said earlier, it causes massive amounts of water loss through diarrhea. And the bug, that cholera bug, is really something, because once it enters the system, it does what's called giving out a toxin, and that toxin is actually what causes issues. So it's in the intestine, and once that toxin is in the intestine, it causes all the water that is inside the body to simply be sort of almost like being sucked out into the intestine, and that's how come you have such massive loss of water.
Wow.
So as that happens, somebody suddenly develops very huge amounts of water loss from diarrhea. So you're going to find somebody who was previously well, suddenly going to the toilet 10 times. They can even go up to 20 times in a day.
And I'm talking about very large amounts.
Very large amounts. And actually,
to the point of liters.
Yes. Sometimes people have little buckets by the bedside because they don't have the energy to walk all the way to the toilet, and they can go all the way up to half a bucket of water in less than a day.
So you can imagine, you're talking about a human body being more than half of the human body being water. So someone has lost all this water, and that's what we call dehydration. So this person gets into a state of there's no water in your body. You're putting it in, it's coming out. And that is when you find if it's someone suddenly their eyes just get sunken. The eyeballs just get sucked in, and they have what we call sunken eyes. People's blood pressures drops because the blood is basically water. So your blood pressure suddenly drops. Then these same people are having vomiting, severe vomiting. It's not only that you're having diarrhea, but you can also have constant vomiting because the intestines, like Dr. Ann mentioned, are still affected, and everything that disrupts them goes down and goes up, and now someone is actually very sick.
Right.
Wow.
And so the trouble also with the fact that you're losing water is that you're not just losing water by itself. You lose what are called electrolytes in the body. What are body salts, really.
Body salts.
Right.
Okay.
So as you're having diarrhea, all of these salts are going into the water that you're losing, and you're passing them out through either diarrhea or through vomiting. Now, what happens is that those salts are actually very important in the way the body balances the way it works. So once you start losing some of these, you also start seeing other symptoms. People become semi-conscious, they become very tired.
They can even become unconscious.
They can actually become, that's right, they can actually become unconscious.
Wow.
Now, then you must remember that because water makes up a large proportion of blood, then that means that you don't have blood going to the key vital organs, and one of those is the kidney. So that means that enough blood is not reaching the kidneys, so you're not getting enough nutrients in the kidneys, and the kidneys start to shut down. So it's not just the fact that you're going to have diarrhea, but it very rapidly progresses into other complications.
Wow, it seems to be a very severe illness which must be taken.
And it happens suddenly. That's the problem.
It's such a sudden onset.
Yeah, it's not like it's like HIV where you'll have some time when the body now starts going down and all that. Cholera suddenly happens.
Yeah.
Wow.
You get it in, and suddenly everything starts happening at the same time.
And
So
sometimes people wait for a fever to come in before they come to the hospital, because classically people know if you have a fever, maybe then you'll go and seek medical attention. But cholera typically does not give you a fever. So instead you have very massive diarrhea, and you're thinking, oh, maybe I can wait a bit and it will
Maybe
go.
something
And then,
I ate,
it's something, and it doesn't go away very fast.
Okay, so the key word here is severe watery diarrhea.
Yeah,
Right.
a lot of water is coming out.
Causing
And actually we call it rice water because it starts coming out because even the food you ate has come out, so you're just seeing water which now starts becoming whitish, like how you soak rice, and then the white water floats on top. So that's what is the typical appearance of the diarrhea.
I see. So what should someone do if they suspect they might have contracted cholera?
Right. So the first thing you must do is you must be able to go to a health center very fast. Because like we said, it is very sudden, it is very massive, it's going to cause symptoms very, very fast. So you must be able to go to a health center. Once you go to a health center, the doctor or the clinician that will be there, usually by the symptoms, so what you tell us that you have, we are quickly able to tell that actually this is likely to be cholera. But also given the fact that we know that there's a current outbreak and there are certain areas, if a patient maybe is from a particular place, all of these things come into play and they tie up the picture really neatly, and so we know you're most likely suffering from cholera. There are tests that can be done, but usually they are done to make sure that actually we are dealing with a cholera outbreak. So there are those that are done so that the government knows that there is a cholera outbreak in a particular place. They take stool samples and they test them and they verify that this is cholera. Yeah. But currently, particularly with the outbreaks right now in the country, we know that the government has procured what are called rapid diagnostic tests. So they take a sample, there's a way they keep it in there, and they take a bit of it and they put it on a small strip and it tests positive, and you're certainly dealing with cholera. Okay. So you don't have to wait until somebody gives you a test.
There's even usually no time for this, because this massive diarrhea, the diarrhea is just too massive that there's no time to.
What do you say is the best treatment for the cholera?
So like we mentioned, being a massive, severe diarrhea disease, you're losing a lot of water, like we have mentioned. The best treatment is giving you back the water that you're losing. Giving you back the water and the salts that you're losing, like Dr. Amate mentioned, you're losing the water together with the salt. So we are trying to give you back. So because sometimes they're vomiting and they still have a diarrhea, giving it orally becomes difficult, because you're taking it in, you're vomiting it, you're taking it in, you're having diarrhea. And like she mentioned, it's coming from all the body parts coming into the intestines. So what we are trying to do is, when we give it through the drip, it is with the salts. And then the body organs, now the systems can now start taking it up. Okay. So the best treatment for cholera is we are getting you back the fluid you're losing. But like we said, it's a bacterial infection. So sometimes we'll need the antibiotics. Yeah,
we do need the antibiotics.
We do need
to treat what's causing the cholera.
To treat the bacteria that is causing the cholera itself. Yeah, but most important, we need to get you back to your dehydration and consciousness, and then give you up with antibiotics to ensure that we manage this bacteria.
Okay, so what is the take-home message? What can you tell the viewers out there? How can they prevent themselves from getting cholera? What should they do?
Right. So the first thing that people need to remember is that cholera is a disease of poor sanitation. So you must make sure that you're taking clean water. Either you boil it at home before you drink your drinking water, or you use tablets. There are tablets that are available and you can put it in the water and it cleans it out. If you're living in a town, Ministry of Water, rather National Water and Sewerage Corporation has chlorinated water. So that's perfectly safe to drink. You must make sure that the food you eat is hot. And if you're not going to eat it immediately, you must keep it in a wrapped place, covered, and you must make sure that it's kept away from flies and away from any other thing that would contaminate the food. You also must make sure, the most important thing, that you must be able to dispose of fecal matter. So if you're going to go to the toilet, you must make sure you have a pit latrine.
Or a flush toilet in your house, and ensure that that they are very clean and quite well maintained. And
so
that
for communities that don't have access to these, what is there a way
that do not have toilets?
Yes,
we have lived in villages. We have been to communities. It is the role of every leader. I've seen communities where the LC1 chairman actually moves from house to house to ensure that every house has a pit latrine. And you don't have a pit latrine, you're in trouble with the law. Because if you do not have a pit latrine, then it is the whole community that you're affecting. If somebody from your house gets cholera, it will spread in the whole community. That's right. So communities that do not have pit latrine, it's the role of not even the health workers, but the role of the government and administrative leaders to ensure that everybody in their community has a pit latrine.
That's right.
And in addition, I think measures like hand hand hygiene.
Basic hand washing,
After
that's
visiting the
absolutely
toilet,
true.
You should
With
be
soap.
able to use soap and
Water to wash your
your
hands.
Because remember, this is an illness that's mainly transmitted in fecal matter. So after going to the toilet, your hands will be contaminated. So you have to wash them clean with soap and water. If you do not do that, then
You're spreading it.
the illness will spread.
Yes, and then we're also talking of food handling. It, in your home, you could be handling your food properly, but we do it in restaurants. So restaurant owners and people who work in restaurants need to take it upon themselves as individuals to ensure that they are protecting the rest of us out there. So restaurant owners need to ensure that the water that is being used to cook and clean the fresh foods is very clean, is highly sanitized, and the workers that they're using have been trained and know that these people need to be to wash their hands with soap and water before handling food and clean their food properly.
And I think they should also, the restaurant should provide hand washing facilities.
Yes.
You won't just walk in and eat food without washing your hands.
That's very
They
true.
always teach us in primary that before you must wash your hands
Before eating.
before
Before
having
eating.
meals or before cooking or after cooking.
And after eating food.
Yes, so a very simple practice as washing your hands can save you a lot from this illness.
That's-
So as we conclude,
But we also, just one thing, need to commend really the government for providing us with clean, safe water, at least for places that have them, have water running in pipes. Clean, safe water is there. We have boreholes, and the government has been able, the Ministry of Water, National Water and Sewage Corporation, has been able to treat the water at the source. To maintain that treatment throughout the pipes and wherever it goes to get into our homes. So that needs to be commended. And sometimes I see messages where they say water has been turned off for such and such reasons, which I imagine will be treatment plants for this water.
Areas that don't have national water connected to them yet usually have boreholes and springs, and these should be protected. So if in our villages, for example, you find that the borehole has a concrete area around and it has been cleaned out properly, and you're making sure that that water does not get contaminated by anything else. The other important thing to remember is that you must not build a toilet or you must not dig a latrine near a borehole, because otherwise you're going to contaminate that water.
okay. And we'll conclude with what's known as a cholera vaccine. I don't know if many of you have heard of that, but fortunately Dr. Fiona is a vaccinologist. I mean, she's a doctor who has specialized in vaccines. So she'll tell us a bit more about the cholera vaccine. What is the cholera vaccine?
Thank you very much. We have technologies in health, much as we have technologies that develop with gadgets and all that. We have technologies in health that have developed. And one of those is the oral cholera vaccine. This is a vaccine that we do not routinely use in our schedule, that you will not go to a hospital and get on a normal day.
Children's
In the children immunization schedule, or even adolescents that we give vaccines. So this is a vaccine that we reserve for cholera outbreaks or for impending outbreaks. For example, we mentioned that we have an outbreak in Kampala, we had an outbreak in Hoima. We used it in Hoima, for example. The outbreak has already started, we have identified it. So we are trying to prevent the people around from getting it. So we give them the cholera vaccine. Then we have the hotspots that we mentioned. These are the border districts and places that could easily get cholera. We also use this vaccine among those people. It's given to children aged 1 year and above. So it's anyone above 1 year of age can get this vaccine. It's given in 2 doses. And we give the first dose whenever we meet you and we think you could get cholera. And then the second dose anytime between 2 weeks after the first dose and between 2 weeks and 6 months. So it's a vaccine that we give you to protect you from an impending cholera outbreak, that you could get cholera. We think you could get cholera right now, or you're in an area that could get cholera. That's the vaccine that we give you. So we do not give it, you won't go to hospital and ask for a cholera vaccine, but we reserve it for such emergencies.
Well, thank you. You've heard it from the horse's mouth. Cholera is a very severe diarrheal disease. It can cause dehydration, low blood pressure, abdominal pain, and ultimately results in death. And the driving factors in cholera are poor sanitation, poor hand hygiene, poor disposal of waste material, fecal material, and poor access to clean water. So you've heard it straight from the experts in the field. So the main treatment of cholera is maintaining proper hygiene, environmental sanitation and hygiene. You must always wash your hands after visiting the toilet, wash your hands before, after handling food, and ensure that the food is handled in a proper manner. It must
Right.
be hot and served hot. So that's it, folks. We hope you've enjoyed today's session. If you have any remarks or feedback, you can always catch us on our social media platforms, on Twitter, on Facebook, and we'll see you next time on the DocTalk Show.